Every 2 minutes, someone dies from lung cancer. That's 700,000 people per year. And the deadliest form is small cell lung cancer, or SCLC. It accounts for 15% of all lung cancers, but has a disproportionate number of deaths because of how aggressive it is. Unlike other cancers, SCLC has a 5-year survival rate of 7%. This is because by the time it's diagnosed, the cancer has already spread throughout the body. It has a very late diagnosis and it's very hard to catch the cancer early on. For decades, treatment has barely improved. Chemotherapy works at first, but it starts becoming less effective very quickly, and immunotherapy hasn't been as successful as we've hoped. The problem is T-cell exhaustion. T-cells are a type of white blood cell, our body's natural immune fighters, but in SCLC, they stop working efficiently. This is because the tumor hijacks the immune system. It produces arginase 1, an enzyme that destroys L-arginine, a nutrient that T-cells need to function. Without arginine, T cells become exhausted, lose their ability to fight tumors, and eventually die off. This is why immunotherapy struggles. The immune system is literally starved before it even gets a chance to fight back. Hi, I'm Avantika, and over the past few months, I've been researching how we can enhance T-cell therapy to be more effective against SCLC. And research suggests that if we block arginase 1, we can increase the function of T-cells to ensure that they can fight back stronger against SCLC and their tumors. Scientists are testing 3 promising strategies amongst many others. Arginase inhibitors. These drugs prevent tumors from stealing arginine, keeping T-cells strong. Engineered T-cells. By genetically modifying T-cells to absorb more arginine, we can make them resistant to arginase 1. In combination therapies, using CAR T-cells and arginase inhibitors to create double attacks on SCLC. You can watch my video on CAR T-cell therapy that goes into this process in depth over here. A 2021 mouse model study published in Nature Cancer tested this idea. Researchers genetically engineered mice with SCLC and treated them with an arginase 1 inhibitor. The results were striking. T-cells regained their function, tumor growth significantly slowed, and survival rates improved dramatically. This was the first major indication that targeting arginase 1 could be a game changer for SCLC. Early studies are promising. Researchers have found that when arginase 1 is blocked, T-cells regain their ability to target tumors, potentially making immunotherapy much more effective. This approach could change the game, turning SCLC from a death sentence to a treatable disease. So, can this work on humans? The answer is yes, it can after research, and we're already working on it. Early phase clinical trials are now investigating arginase inhibitors in cancer therapy. One study tested the drug INCB001158, an arginase inhibitor, in patients with solid tumors. When combined with immunotherapy, it showed higher response rates than immunotherapy alone. This suggests that blocking arginase 1 could make T-cell therapies work better in aggressive cancers like SCLC. Other approaches are also being explored, genetically engineering T-cells to resist arginase 1. By modifying CAR T-cells to function even in low arginine environments, researchers hope to make T-cell therapy viable for SCLC, and using CRISPR to knock out arginase 1 expression in tumors, a potential way to prevent SCLC from hijacking the immune system in the first place. We're entering a new era of cancer treatment, where we engineer immune cells to resist tumor suppression mechanisms. If arginase 1 inhibitors succeed in clinical trials, we can combine this with immunotherapy to significantly increase the survival rates of SCLC. While work still needs to be done, the future of T-cell therapy in SCLC is promising, and we're just getting started. I can't wait to see what happens next, and I hope you join me on this journey. Thank you so much for watching.